Hello guys, welcome to Medycoding.com. In this lecture, we are going to learn about the urethra. So urethra is the topic of urinary system. We already seen the previous topics like kidney, ureter and bladder. So now in this lecture, I will discuss urethra. Okay? So first for all, we will discuss about the male urethra and then female urethra. Because there are so many things to know in male urethra and only few things in female urethra. So let's get started. Urethra. So the male urethra is a musculo-membranous tube that is around 18 to 20 centimeters long, and for female it only around 3 to 4 centimeters. So the length of urethra in male is longer as compared to the female. So it extends from the internal urethral orifice, as we know from previous lecture that the location of the internal orifice is in the bladder. So male urethra arises from the bladder and the end point is the penis. The end point of penis is known as meatus. So because of the penis, the length of male urethra is longer. Okay? So male urethra has two functions. The function of male urethra is to release the urine, and other function is to passage of semen. So it acts as part of urinary system and also it is a part of the reproductive system. Now we will see division of the urethra. So based on the location, male urethra is divided as posterior urethra and anterior urethra. So the part that is closer to the bladder, or you can say that is on the back side, is known as posterior urethra. And the part that is in the front of a body, that is anterior urethra. So there is one division line, that is urogenital diaphragm. So it separates the anterior and the posterior urethra. So in this figure, you can see this muscular sheet that is on the pelvic floor. So this is urogenital diaphragm. So this supports the pelvic organs and helps control urination. What are the parts of male urethra? So urethra is divided into four parts. The first part is pre-prostatic urethra, second is prostatic urethra, then membranous urethra, and the last one is spongy urethra, that is also known as penile urethra. So we will discuss each part in detail. So the first part of urethra is pre-prostatic urethra. So as the name suggests, pre-prostatic, it means this part of urethra is found before the prostate. Other name of this is intramural urethra. As we know that intramural means within the wall. So the urethra that is found within the wall of the bladder, that is known as intramural urethra. Also, we read in for the ureter lecture, like intramural ureter means the part of the ureter that is found within the wall of the bladder, that is known as intramural ureter. Hope you have already watched the previous video. So, pre-prostatic urethra is found at the neck of the urinary bladder and it is surrounded by internal urethral sphincter. So as we read what is internal urethral sphincter in previous lecture, so it is a smooth muscle, okay, that is not controlled by our wish. So it is an involuntary muscle. So it has two functions. The first function is to prevent retrograde ejaculation. Ejaculation means releasing the semen out of the body. So the function of this muscle is to prevent the backward flow of the semen to the bladder. So because it contracts during the ejaculation, so the semen will not go backward. So this is the function of urethral sphincter. The other function of internal urethral sphincter is to maintain continence, means it prevents the urine leakage. Due to this muscle, the urine is not leaking. So if it will not work, then the urine will leak. Prostatic urethra. So this is very important part of the urethra. So it is that part of the urethra that goes inside the prostate gland. So that length of the urethra is known as prostatic urethra. So there are some important location here. The first is the urethral crest. So urethral crest is a long ridge. So it is elevated part on the posterior wall of the prostatic urethra extended longitudinally. So in this figure, urethral crest extends from here to here and it ends at seminal colliculus. That is also known as verumontanum. So it is the highest point on the ridge. So the function of this is to provide the opening for the ejaculatory duct. Also, it allows the semen to enter the urethra during the ejaculation. It contains the prostatic utricles. So we will see function of these structure in the next slide. Now let us discuss about the structures that is found in the prostatic urethra. So this is very important. The first is the prostatic utricle. So it is a small pouch, means you can say it is a sac-like structure that is found at a position of the verumontanum. The next structure that is found in prostatic urethra is ejaculatory duct. So these are the ejaculatory ducts you can see in this figure. So the function of this is to carry the sperm and seminal fluid. So ducts open in prostate. Two ejaculatory ducts, one from right side and other from left side. So this image is the correct representation of ejaculatory ducts. So the next is prostatic duct. So the prostatic gland also secretes some fluid that helps the sperm to move. So this is secreted by a duct that is known as prostatic duct. So it will also open in the urethra. Membranous urethra. So this is the third part of the urethra. So this is the shortest part. It passes through the urogenital diaphragm. So this urethra is surrounded by an external urethral sphincter. We already know the location of the internal urethral sphincter. So in this area, an internal urethral sphincter is found. And in this area, this location, an external urethral sphincter is found. And this structure is urogenital diaphragm. We can control this muscle by our wish. So it is a voluntary muscle. But internal urethral sphincter muscle is the muscle that we can't control. So this is involuntary muscle. So this is the narrowest and the least dilated part of the urethra. Spongy urethra. So this is the last part of the urethra. This is very important. And we have seen pre-prostatic part of urethra, prostatic part of urethra, membranous urethra. So all three are the part of the posterior urethra. But this one, spongy urethra, is the part of the anterior urethra. So this area of the penis, that is the root of the penis, is known as bulb. That is the bulb of the penis. So the bulb of the penis is the expanded proximal part of corpus spongiosum tissue. And this is an erectile tissue. So it is a special type of spongy tissue that can fill the blood and it becomes erect. And this area of the penis is known as glans penis. So it is the rounded, enlarged tip of the penis. So this part also contains the corpus spongiosum tissue that is also found on the bulb of penis. So I'm telling all this here so it will be easy to understand for next slide. Okay? Course of spongy urethra. Okay? As you can see in this figure, this is the membranous part of the urethra. So a spongy urethra starts as the membranous part ends. Then it will go to the bulb of the penis. Then the body of the penis means this shaft part. This is known as body of the penis. And this is the glans of the penis. In the glans of the penis, there is opening. Then that is external urethral meatus. So the spongy urethra is divided into three parts: bulbar urethra, penile urethra, and the fossa navicularis. So you can see in this figure, this area, this dilated part of the urethra, this area is known as fossa navicularis. We will see this all in detail. Bulbar urethra. So this is a part of the spongy urethra. Okay, so we have seen that the bulb of the penis, so the urethra that is going in that bulb of the penis, that is known as bulbar urethra. In bulbar urethra, the duct is opening, that is known as bulbourethral gland duct. It is connected to bulbourethral gland, that is also known as Cowper gland. So, this Cowper gland secretes a fluid that lubricates the urethra and protect the sperm. The bulbar urethra is the common injury site that usually occurs. Penile urethra. So this is the longest part of the urethra. So this extends all over the shaft of the urethra and it is enclosed by corpus spongiosum. Okay? It has a small opening that is known as glands of the litter and it's also secret fluid for lubrication. We will see these male reproductive part in separate anatomy lecture in detail. Fossa navicularis, this area is glans penis, okay? The urethra here is dilated. That is known as fossa navicularis. This opening is known as meatus. So these are the dilation part and the narrowing part. At the bulb part of the urethra, there is some dilation, that is the natural dilation. And in the fossa navicularis, there is also dilation. And this end point where the urine is out, that is meatus. That is the narrowing part of the urethra. Thank you for watching and please support us by liking our video and give you comment. If you are watching this video in YouTube, then must visit website Medycoding.com, the best place to learn medical coding. Because in website, you will get more anatomy videos. The same topic video that you are watching now will be updated after some time with more clear explanation.